And today we have Julie Gilbert with us. She's Senior Education Debt Management Specialist at the AAMC, and she'll be giving a presentation for us.
Morning, everybody. Can you hear me? Okay. I am very happy to be here, but I'm even more thrilled to see that I have a lot of people here because nobody ever wants to talk about paying for school or paying for anything for that matter. So I am really glad that you're here. Today's presentation is paying for medical school and how you're going to do that. I know it sometimes seems a little scary because we're talking about a lot of money, but what we want you to understand from the AAMC, which is the Association of American Medical Colleges, we're the people that do the MCAT and the AMCAS and all that good stuff too, is that the resources are there for you, and we're here to help you along the way, including with understanding how to pay for medical school. I'm going to put in a plug for our booth. We are in the quad, I guess it's called. We have like 8 tables and a lot of good stuff to give away. So please come over. Trail Mix is there if you're hungry. Please come join us. And come over and ask us any questions. We have representatives there from MCAT, AMCAS, SMDEP, a lot of different programs that we're happy to talk to you about. So without further ado, I am going to get started talking to you about my favorite topic, and that is, how are you going to pay for medical school? The card that I just gave to you is hot off the press, brand new. You're the first ones that are seeing this. So I tried to do the presentation to go along with the card so you can refer back to it. And if you ever have any questions, feel free to raise your hand, speak while we're going through this, come to the booth, or afterwards, you're more than welcome to email me as well. If you go to our website, which I will give you, it's in the presentation and it's also on the card, you can certainly get to us that way as well. So first of all, today we're going to go over knowing the cost, exploring different financing options, borrowing smart when you do borrow, if you do borrow, managing your money wisely, being aware of credit because that has an impact on you while you're in school, and exploring forgiveness and repayment programs because it's never too early to do that. So first of all, knowing the cost. How much does it actually cost to go to medical school? Is that the top thing that you're looking at when you're thinking about going to medical school? Maybe not. It's probably something you think about after the fact because you're thinking about these other things. First of all, you're thinking about how am I going to pay for the MCAT exam? There's a test for the application itself, and depending upon how many schools you're applying to, you're going to have those fees. You might decide on a Pivio subscription, which is an online portfolio of your information that you can start using now. It's brand new. There's also secondary application fees that you might have for some of the schools that you're applying to. So all of those things go into the cost of education and the cost of applying for medical school. Now, the AAMC does have a program called a financial assistance program. We also have information on this on our website and at the booth. But this program can help reduce fees and or give you a waiver towards some other of the application fees. So it's a really good program. It's for those that have need. So you might want to take a look at that. The website's there. You can also get to all of the information I'm giving you from the AAMC's website, which is aamc.org/students. All right, so those costs pretty much across the board, everybody's going to have those costs. But then there are some variable costs that you might also have, depending upon if you're going to take any type of MCAT preparation courses. Are you going to pay for the online guide to medical school information to find out what are the requirements for many of the medical schools and where would be a good fit for you and what are their philosophies? The MSAR has that information. Not to mention, depending upon where you live and where you're thinking about going to school, the costs actually go to the different schools for interviewing, clothing, travel, all that good stuff. And then when you do get accepted, moving expenses, because if you're going across the country, that's going to cost as well. So those are some of the things that you need to keep in the back of your mind. I realize that applying and getting in is sometimes, the most important and that's on the forefront, but these are the other things that you do need to think about as well. So now we're going to actually take a look at the numbers. Has anyone done this yet? Oh, not everybody jumping up on that one. Okay. For the 2013-2014 year, these are the costs for tuition and fees alone at a public or a private school. Okay, that's 1 year. Now, the cost of attendance, that's a little bit different than just tuition and fees. It's actually the cost of room and board, transportation, miscellaneous expenses, if there's any type of insurance fees or any other costs that are built into the actual program at the school, they go into the cost of education or cost of attendance. So that's the cost, the $55,577 for public and $73,737 for private. Again, those are median costs, and they are for 1 year. So then if you look at the 4-year cost of attendance, you have the bottom number, okay? Yes, that is a lot of money. There is no two ways about it. That's a lot of money. And the reason we point this out is not to freak you out or to upset you, but it's to also let you know that there are ways to finance that. There are ways to pay for school. Again, not a great topic because of the fact that this slide shows that most students that go to school, 86% of the medical students that left school last year had medical school debt, which means they took out a loan. It's pretty much a fact of life that they take out loans. Yes, sir?
Quick question. When you showed the cost, you said 218 is the total cost plus the cost of tuition.
The cost of attendance includes the tuition and fees.
Okay, but somehow the math didn't seem to work out. It's 210, 55 into 4 is 210 plus 32 should be 252, something
No.
like that.
If you look back here, that's just tuition and fees. That's the top line, but
Yeah.
the second line is the cost of attendance, which includes tuition, fees, room and board, and
Okay.
all the other expenses, and then the 4-year cost.
Thank you.
And again, these are just median. You want to take a look at the specific schools you're looking at to see how much it's going to actually cost you to attend the school there. Okay, so this one is just showing you that 86% of students actually do leave school with medical education debt. These are the amounts that are common across the board for public and for private. So one of the things that you should be thinking about when you go to schools is perhaps you want to talk to the financial aid office and ask them 2 questions. One, does your school offer any type of scholarship funding or institutional funding to attend school here? See if there's any type of free assistance that they can provide you to go to school there. The second question that you may want to ask is, what was the average student debt for your class that just graduated? That will kind of give you an idea of what you might be looking at borrowing, okay? Now, this puts it all into perspective, okay? That is a lot of money to go to medical school, but when you graduate and once you actually start practicing, these are this is the data from the MGMA survey of physicians just starting out and what their starting salary is. So what I really want you to see from this slide is that, yes, you may borrow a lot of money to go to school, but you're also going to be making a sizable salary that will allow you to pay back your student loans, because the way the student loan programs work is generally speaking, they're very flexible, and they help you with different options as far as postponing payment, maybe when you can't afford to make a payment, or giving you the options of a reduced payment. Okay, so this is a feel-good screen, okay, shot, all right? Do you feel good now? All right, so let's take a look at actually what are the options for financing medical school. The very first thing, of course, is filling out what's called the free application for financial student assistance, the FAFSA form. Now, if you're an undergraduate student, you may be very familiar with this form. Maybe you didn't borrow any financial aid for school, so you're not familiar with this form, but this is the very first step in applying for aid. Many schools use this form to determine your eligibility for grants and scholarships at their schools, as well as the federal aid funding. One of the most important things that you can do is talk with the financial aid officers at the school. When you're going to your schools for interview, I highly recommend that you also set up a time to go in and speak to the financial aid office. Make them your friend. And if you think that, financial aid at undergrad was really difficult, that you didn't really have anybody to talk to, I'm here to tell you, Many of the medical schools have a financial aid department specifically to work with health profession students or medical students. So it's more of a close knit. They pretty much know you by the time you're done with school. So make them somebody a great resource for you to go to ask questions. You do still need to research and apply for outside scholarships just like you would with an undergraduate. So you might be needing to go to some of the websites like FastWeb, that kind of thing. You might be needing to check with employers, civic organizations, clubs, and other community organizations that you're involved in that might offer a scholarship or grant. Those are things that you continually want to look for, regardless of whether you're a first-year med student or a fourth-year med student, because there are programs out there, but you have to look for them, okay? So, the different types of ways to pay for medical school include these things. You have grants and scholarship, which are generally your free money, the monies that you don't have to pay back. They're generally going to be based upon need, and need is calculated, that's a financial aid term, where they take a look at how much, it's not, everybody's going to say they have a need for money for financing school, but they take a look at the actual cost of attendance and what's called your expected family contribution on your FAFSA form to determine if you have need. Then the schools may have their own setup as far as offering institutional scholarships and grants based upon their applications as well. Then there's federal student loans. This is when I say that 86% of students borrowed, they borrowed from these programs. The federal Stafford loan, the federal PLUS loan, Perkins loan, LDS, and PCL, primary care loans and loans for disadvantaged students. Okay? Then the other sources that you can always think about is going to your family. If that's a possibility, it may not be. For some, it may. Service-based aid. If you want to give back to the community, there are some programs where if you will work for them, they will help you with school. And we're going to talk a little bit more about those, and I'll give you some websites for those if that's something you're interested in. And then, like I said, outside scholarships, clubs, organizations, employers that you might have worked for or your parents may have worked for that may offer some type of financial assistance. Now, when you actually fill out your FAFSA form, you fill that out every year, and the school will determine how much aid you qualify for. They will say you can borrow this much money. You do not necessarily need to borrow that much money, okay? You have a choice. If you need all of the money, fine, but if not, think about it. Borrow smart, because if you don't take all the money, then that's less money you have to pay back with interest. Generally speaking, if you're offered an amount of financial aid for a loan and you decide not to take the full amount and you find out a little bit later in the year that you actually did need that money, you can go back to the financial aid office, and depending upon deadlines and things like that, you can usually get that money back if you didn't accept it all in the beginning but found out you needed it later, okay? So decline loans that you don't need, and accept loans. Accepting loans that the school may not be aware of can affect your financial aid eligibility. So again, communicating with your financial aid office about the outside types of scholarships or grants or any additional loans that you may be getting is very helpful. So have that communication with the financial aid office. And again, when you're borrowing, borrow smart in the term of how much is this really going to cost me? And when we're talking about that, we're really talking about origination fees and primarily interest rates. So when you have a lower rate loan, that would be the loan that you generally want to take over the higher interest rate loan. This next screen kind of goes in order. Of course, you want to take the free money first, the scholarships and the grants. Then if you're offered a Perkins, a primary care loan, or a loan for a disadvantaged student, those are generally lower interest rate loans, so you may want to accept those. You may not be offered those. They're not offered to everybody. Then you have your federal direct Stafford loan, then the direct plus loan. And then if you still need additional money, you might look at private or what we call alternative loans, or worst case scenario is probably going to a credit card unless you can pay that off quickly. This is a screenshot to show you what the interest rates are. When I say that the interest is really what comes into the total cost of how much a loan is going to really cost you by the time you're done with school, is you take a look at the interest. A Perkins loan, for example, is a 5% fixed interest rate. The Stafford loans for this year when you take out a loan, it'll be 6.21%, and it's a fixed rate, whereas a Direct Plus loan is 7.21%. So the difference in the interest rates will determine how much it's actually going to cost you when you go to pay back the monies. Now keep in mind, this is for the 14-15 year. Interest rates on the Stafford Plus and on the Direct Plus and on the Stafford loan, they do change every July 1st. So these rates will change, but right now, these are fixed for the year. So this shows you, if you borrowed last year, the median amount of debt that students borrowed was $175,000. While they're in school during that 4 years, the interest that accumulated on their loans was $26,600. That gets added once they graduate. So then they're looking at, how much am I actually paying back? $201,600, okay? So that's why interest means so much. So be careful about what you borrow because of the interest rates. Yes? Yes, interest compounds, yes. So once you get done with school, that's the compounding, the 26.6, it's called capitalization. Yep. Yes?
Are there any loans without interest rates? I know there's two types of loans.
Well, there'd be scholarships and grants, which wouldn't generally have an interest rate because they would be the free money. But to my knowledge, I don't know of any loan that has no interest rate. Unless you have like an outside organization that says, we'll loan you this, you know, at 0%, but I haven't seen that.
So what's the difference between subsidized and unsubsidized?
Subsidized, very good question. Subsidized money, the government pays the interest on the loan. An unsubsidized loan, the government does not pay the interest on the loan. As medical students, you're a graduate or professional student, and that means that you will only qualify for unsubsidized loans. The government no longer allows graduate students to borrow subsidized money.
Yeah, that was my question. It's like about, the old loans, they did not accumulate while you were in school,
Right.
but they do now?
They do
Okay.
now. And so that's why once you graduate, that $26,600, that's the interest that accumulated while you're in school. And so it's compounded and it's capitalized and added to the loan that you borrowed as you went through school. Yep. So that's why interest matters, okay? So be aware of that. You want to always manage your money wisely, whether or not you're in medical school or not in medical school. But some of the things that you do now can affect you when you get into medical school. Some of those, I'm going to assume some of you are already college students and you're already borrowing money maybe for undergraduate school. So I'm going to go out on a limb here and say, probably not everybody knows what kind of loan they have right now, what interest rates they have right now, or how much total they have borrowed. Is there anybody that can give me a shake of the head that tells me I'm true or not true with that? Okay, I see some. All right, so what you want to do now before you even start medical school, my advice to you would be to get this all down, to get organized. So if you have loans currently for undergraduate, you want to find them. And the way you find them is you go to nslds.ed.gov, this National Student Loan Data Service. It's very easy. All you do is you put in your social security number, your date of birth, your first two letters of your last name, and the number that you used for signing your FAFSA form. This will show you all of your federal loans, okay? If you have outside loans or sometimes institutional loans, they're not going to show up. It's only federal monies, but at least you could go there now and get an idea of what you have currently, okay? And then start keeping track of that. All right? Once you have that information, this is a resource that our first program through the AAMC makes available to you. www.aamc.org/first is the website for the financial information for medical students. Within our website, we have what's called a MedLoans Organizer and Calculator. It is free to use. Right now, you can go in, put in your loans, think about how much you might borrow to go to medical school, and say, what is my payment going to look like? The calculator will show you those options, okay? You can do that now. The only thing is you won't be able to save your information until you're actually a medical school student. Once you're actually a medical student, you get free access to this. But currently, you can just go in and play around with the calculator, but you don't have to pay for it. But it'll give you an idea of what you'd be looking at if you do borrow the full amount for 4 years in medical school. The nice thing about the calculator is there's a program called Public Service Loan Forgiveness, where it actually shows you if you choose to go into public service, how much money might be forgiven from your loans as well. So people like that feature so that they can see that too. All right, so my tip to all of you, and I know some people don't like to hear the word budget, so we use the word spending plan because everybody spends, right? You need to have a spending plan, and that's going to help you out as an undergraduate going into medical school and as you continue with medical school. We have a lot of resources available to you on the first site. We have this budgeting fact sheet where you can keep track of how much money you're borrowing right now so that you can hopefully prepare yourself for going to school. Then you want to actually set your budget. So take a look at what income you have now, subtract what your total expenses are, and that will show you what your discretionary income is, how much money you have for the fun things on a month-to-month basis. And it really kind of puts things into perspective so that you can start to take a look at how you're budgeting your money and how you're spending your money, or maybe where you need to cut back. One of the things that we find that a spending plan does by doing this is you actually get to see some of the frivolous things we might spend our money on. It kind of puts it into perspective. But if you have a budget, I recommend putting it in writing. Take a look at it periodically to see where you might have some leaks and make some necessary adjustments. My leak is I live in Pennsylvania and work in DC. I go home on Thursdays, and I always stop at McDonald's for my Diet Coke. Well, do I need to do that? No, I could be taking a Coke with me. All right, but those are some of the things that I don't really think about until I actually sit back and I look at how much money I'm spending. So keep in mind to live like a student while you're a student so that when you're not a student, you don't have to live like one. Okay? One of the things here, and this is just a primary example. If you don't like coffee, substitute something else for this. But if you drink a cup of coffee, gourmet coffee at the coffee shop, $5 a day, 5 days a week, you're looking at $1,000 for a year. Over 4 years of med school, that's $4,000. Is anybody budgeting $4,000 for coffee for medical school while you're in medical school? Probably not, okay? So if you make your coffee at home, $10 a month, $100 a year, $400 over 4 years. Okay, just some things to think about, so that you make the right decisions when it comes to those loans, because if you don't need to borrow all of the money that you're awarded because you already cut back on some of these things, it will help you in the long run. All right, the other thing that's going to help you prepare to pay for med school. The loans are going to be there, the scholarships, the grants, they're going to be there, hopefully, the grants and scholarships. But the one thing that you have total control over is your credit. And that's important now as an undergraduate student as well as when you go into medical school. You need to check your credit report. You can do this free on this website, annualcreditreport.com. You can get your credit report from all 3 credit bureaus once a year. And I recommend that you do that and take a look at it, see what's on the credit report, because unfortunately, many times people are a victim of identity theft and don't even know about it. And if you don't borrow as an undergraduate student and you go to medical school and you find out that there's a problem with your credit report and you can't get a loan, maybe a plus loan. A plus loan is, they look at your credit for a plus loan. If you have negative credit history, you may not be able to get that plus loan. So you want to make sure that everything's okay with your credit now before you get to that point, okay? Some of the things to keep in mind about your credit is your FICO score is what determines, when we talk about your credit score, that's really called your FICO score. These are the 5 main factors that make up your credit score. And if you take a look at it, the biggest part of your credit score is your payment history. So if you have a cell phone payment and you're not making that payment on time, that's going to affect your credit score, okay? If you have a credit card and you just couldn't make that payment this month, that's going to affect your credit score because you'll be late, okay? So all of those things go hand in hand with the next step of borrowing money. So you want to make sure that you have a variety. If you do have a multiple types of credit, you want to vary it. You don't want to apply for credit if you don't need it. So when you go to the store and you're checking out and they say, oh, would you like to get 10% off your total purchase? You want to say no because that's new credit. And if you don't need new credit, that's going to lower your credit score. The types of credit you have, again, the biggest thing is how you're paying on your loans, any type of credit that you have, and the total amount that you owe. It is actually possible that while you're in medical school, you can improve your score before you get out of medical school. Because if you pay your bills on time, if you pay down any debt that you have before you go to school, while you're in medical school, and if you apply for credit sparingly, you could very well get out of school and have a higher credit score, okay? Which can help you then when you go to buy a house or buy a car, those types of things, okay? Yes? For the Stafford loans and the PLUS loans? No, you do not, okay? And that's the one nice thing about the federal loan programs is you don't have to have a credit history. Now, with the PLUS loan, that one does look at your credit history as far as if you have any negative credit history. And if you do, then there could be an issue. But not all students borrow a PLUS loan, okay? Because if you're managing your money and doing these types of things, there may not be a need for you to get a PLUS loan, okay? The other big thing that we like to warn students about before you get to medical school is making sure that you're managing your credit cards properly if you have credit cards now. This is one of the biggest problems that we see is that students tend to fall into the minimum payment trap. You know, it's not so bad when you have a $5,000 bill, but you only pay $50 a month, right? Well, but what really happens? If you have a $5,000 balance on a credit card with 18% interest and you only make the minimum payment, what really happens is you're taking 22.75 years, 22 and 3/4 years, $12,000 to repay that $5,000. What is possibly so important to do that? It's hard to think about until you put it in this perspective, because you really want to think about how much money you're putting on those cards. So be careful about that, because again, it all comes together when you do go to borrow loans. One of the next things that I'm going to talk about is loan forgiveness and loan repayment programs. Many students, I get this question a lot. You know, I have these loans, how can I get any of this money forgiven? Or is there any way to help so that I don't have to borrow this money? If you plan to go into primary care, or if you want to serve, maybe you want to go into the military, there are some programs that do offer loan forgiveness, or there are loan assistance programs while you are studying to be a medical student. Some of these are just examples, but the National Institute, National Health Service Corps, the Public Service Loan Forgiveness. That's actually, the Public Service Loan Forgiveness is a program for anybody that borrows federal Stafford or federal direct PLUS loans. So the other ones are actually through other organizations. This is a list, and I'll leave this one up here a little while, but the AAMC, our first website, actually has a scholarship and loan forgiveness repayment database. It's broken down by state, and some states offer certain benefits or some loan forgiveness or assistance to students that are going to practice in their state. You might want to check out that website. Many times it's after you've gone to school, but it's a good idea to have it in the back of your head to know what might be available. The NIH offers loan repayment programs. The National Health Service Corps also offers programs for loan repayment. And then again, like I said, Public Service Loan Forgiveness is a program to help pay off or pay down your student loans, which would be your Stafford and PLUS loans if you do borrow those. Generally speaking, and all programs are different, but generally speaking, it's that you're going to make a commitment to serve in an underserved area for a certain amount of time, and during that period, they will then offer you repayment assistance with your loans. Okay, so they're really good programs to think about before, depending upon what specialty you might be going into. So there is a lot of support along the way for students that are in medical school, and these are just some of them. I'm going to talk about these briefly, but basically the medical school themselves, you want to, again, talk to the financial aid office, talk to the current students that are at that school. If you talk to the financial aid office, I'm sure they can give you some students that might be willing to talk about their situation. A lot of current medical students, you guys are all here today. When you go to some of these sessions and you're actually talking to students, I highly doubt it's going to be the topic at the top of the list, but you might want to say, did you encounter any problems paying for medical school? Are there any suggestions of things that you would think about differently if you were in my situation and just starting out? And some of the things that I talked to you about today are probably going to be on their list. The other thing, a really great resource is this Department of Education's website. It's studentloans.gov. All of the loans that I talked to you about, the Stafford loans, the PLUS loans, the primary care, Perkins loans, all of those loans are detailed on the Department of Education's website. They're on our website as well. I'm just giving you multiple places to go for information. The school's websites are also another excellent place to check for information. It's very important that you make sure that you're meeting deadlines when you're going to apply for aid at certain schools. So make sure you check out the Financial Aid Office's website as well, because they're going to have their application procedures and their requirements on theirs to help you out. We also have careers in medicine. If you want to take a look at a specific specialty that you're interested in, you can use them as a resource. They'll show you what a surgeon might be making. Even I know my slideshow do that, but they have more in-depth information to help you figure out what the specialty would be best for you based upon your goals and aspirations and your background. We also have, like I said, the MedLoans Organizer and Calculator, which is free for medical students to use to help you track and keep track and organize your loans and figure out how to pay those loans off. And of course, our website, aamc.org/first, has a host of information. We have fact sheets, we have videos, we have our contact information. We also have a number of resources and links to other programs and other information that might help you with borrowing or paying for medical school, because we also have another big program called for financial literacy. So maybe you're not so great on budgeting, maybe you're not so great on understanding your credit. We have modules that help you with that as well. So all of these things kind of all go together in figuring out how can you pay for medical school, how can you get there, because you can do it, you can borrow, and you can generally pay it back because of the programs that are available to students. So with that said, what kind of questions do you have that weren't answered here today? Yes.
The AAMC.org/student/aspiring, what was that?
The Aspiring Docs, that's part of, it's on the student's website. It's aamc.org/students and then Aspiring Docs. On that website, there's information about, actually it's a great website. It shows information about students who are currently medical students and what they're going through. It answers a lot of questions like, what's it like to be a physician? What's it like to, what should I do to work with my advisor? So a lot of different questions are answered on their website to help pre-med students figure out if a career in medicine is right for them.
URL again?
Sure, it's aamc.org/students/aspiring docs. One of the great things they also have going on this year, they just started it, it's a blog with current medical students that are actually blogging about what they're going through as a first-year medical student, as a fourth year. So it's really, really good information. I highly recommend that. Yes?
You were talking about the interests and other costs.
Mm-hmm.
Are these interest and repayments tax-free?
Are they tax-free? No. Some of the loan forgiveness programs, and it depends upon which loan program, but there are some loan forgiveness programs that you'll still be charged on the tax, but then there are some that aren't. So you have to take a look at the specific program to find out if that forgiveness is taxable.
Thank you.
Okay. Yes?
So if you're considering going to an international school that accepts U.S. financial aid, are there any limitations right off the bat of like what kind of financial aid you can get in terms of like PLUS loans, Stafford loans?
If you're going to an international school and they accept U.S. federal aid, it should be similar to anything that you would be applying for here in the U.S., okay, if they accept U.S. federal aid. If they do not accept federal aid, that changes the whole program, because then you wouldn't be eligible for Stafford or Plus loans. You wouldn't be eligible for Perkins loans, okay? So knowing that information, I would highly recommend, if you're looking at an international school, to get on their website, to talk with their financial aid officers, and to talk with current U.S. medical students who went to school there and how they funded their medical school, because that's really important to know. Very
All right.
good question. Thank you.
Thank you.
Yes.
When we're using the thing to check our credit,
The annual credit report, the score? Uh-huh.
Is that putting a ding on the credit?
No, it is
isn't?
not. She asked if you go and pull your credit report on annualcreditreport.com, is that putting a ding or a hit on your credit score? It is not. That is free to you to do. You can do it once per year for each credit bureau. So no, it's not. The only time you get a ding or a hit on your credit is if you're applying for credit and the lender is looking to see what kind of credit risk you would be for them. Good question. Yes.
Does the amount of the free money that gets dispersed depend upon like a first come, first served basis?
It depends upon the school. You would have to talk to the school's financial aid office and find out how they distribute their aid.
Well, what website did you recommend for spending plans?
For spending plans, the first website, it's aamc.org/first. At the bottom there, we also have the information on public service loan forgiveness, but we also have, it's called Financial Literacy 101, and there's tons of information on managing money, as well as different fact sheets. Fact sheets are just one-page documents that kind of go over lots of different topics, from repayment to borrowing to budgeting to credit. So there's a wealth of information there. Other questions?
Earlier on, you mentioned with the one particular loan, it's based upon what your parents', I guess, income is, and then what you can apply for.
That's when you fill out the FAFSA form. The FAFSA form determines your eligibility for aid. I'm glad you brought that up. Some schools will require it, even though by federal regulations you are considered an independent student and you don't need your parents to apply for financial aid. Some schools will still require parental information on the application to determine your actual need for aid. So when you're applying for the federal loans, parent information isn't determining your eligibility for those loans. Okay,
Great.
so primarily it's the school that will want to see that information, because in the federal government's eyes, for the federal loans, the student is independent if they're over 24.
Thank you.
Any other questions? Okay. Well, I invite you, if you don't want to ask the question in a larger group, please come to the booth. Again, we have lots of great stuff to give out too, and we're happy to answer any questions that will help you on your path to medical school. Thanks for coming.